Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Dr. Melissa Kaufman and Dr. Linda Brice. They're joining us here to talk about bladder incontinence and fecal incontinence. Welcome to Health Professional Radio, Dr. Kaufman and Dr. Brice. Thank you for joining us.
Thank you for inviting us.
Yes, thank you, Neil. We're delighted to be here to uncover some aspects of this topic that's often hidden.
Great. Well, I'm thankful that both of you could join us this evening. Dr. Kaufman, if you would give us a look into your professional background, and then Dr. Brice, if you would do the same.
Okay. Yeah. So I'm Melissa Kaufman. I'm currently a professor of urology at Vanderbilt University Medical Center. I'm the chief of reconstructive urology and pelvic health and the Patricia and Rhodes Hart Endowed Chair in Urologic Surgery. My practice focuses on male and female incontinence and voiding dysfunction, as well as surgeries for reconstruction with urologic prosthetics, female pelvic organ prolapse, fistula, and trauma.
Dr. Brice, 30 years I was a nurse, but that was my third profession. First, I did serve in the Air Force and was a captain in the Air Force. But the 30 years as a nurse, 14 of it was labor and delivery and women's health. And then I earned my PhD in nursing, and now I have been teaching, or had been, I just retired for 15 years, and in the area of obstetrics, gynecology, community health, public health, and that's the love of my career.
Dr. Kaufman, overactive bladder, or OAB, and fecal incontinence, FI. What is overactive bladder, and does it go along with FI all the time or just some of the time?
Well, that's an excellent way to begin the discussion, just with basic characterization of what it is that we're talking about. An overactive bladder is fundamentally a group of symptoms that a person can experience, but it's really characterized by urinary urgency. And this is really a compelling desire to urinate, which is difficult to defer. And this is often associated with frequency to need to urinate, including frequent nighttime urination, often termed nocturia. And often associated with this is urgency incontinence, or leakage of urine associated with the urges. Now, interestingly, when I first began my career, I would see patients and actually place the types of devices that Dr. Brice has and that she'll discuss later for this overactive bladder symptoms. And I had patients coming back and said, yes, it's very effective for my bladder, but interestingly, it's also very effective for the symptoms I'm having with my bowels. And this kind of was a light bulb moment to recognize the comorbidities that we see with both bladder and bowel issues. And it turns out that fecal incontinence is one of the most debilitating conditions that patients experience, and one of also, as I mentioned before, the most hidden conditions. Patients are very reticent to seek care for this because it is quite embarrassing, and they will oftentimes be left in isolation. But it does go along with overactive bladder. These are fundamentally pelvic floor disorders that many patients have at the same juncture, at the same time, and they have lots of overlap with both the actual pathophysiology of what's occurring and the treatment strategies that we employ for them.
Now, Dr. Brice, I understand that you have had to deal with overactive bladder. How has it affected your everyday life, and what is this device that Dr. Kaufman is describing?
Well, I've had incontinence for the last 17 years. It came on all of a sudden. Mine is a neurological problem. And the big thing was the first time it ever happened, I gushed urine everywhere. And from there, at that point, it kind of went downhill. I never knew when I was going to, lose my urine. I had to know exactly where every bathroom was. I couldn't travel. I couldn't, do anything. I'd have to wear dark clothes because if I had an accident, I didn't want anybody to know until I could go change clothes. But one of the biggest problems was that I was teaching nursing students, and I had to take time over and over and over during my 2 to 6 hour classes for me to stop and go to the bathroom, and it was destroying my classes. The next thing I had to do was to basically stop taking in fluids. If it didn't come in, it didn't have to go out. But after a while, that damaged my kidneys. So I had to finally bite the bullet and go see my doctor and say, okay, this is what's going on. Can you help me? And then when I moved from Texas, where I taught, to Tennessee, that's when I met Dr. Kaufman, and she has been my hero. She's given me back my life. She's given me back my quality of life and my freedom. And I've had it's called a Medtronic InterStem device, and I've had that in my hip now since about 2008. And it's made all the difference in the world. I don't have to track down every bathroom in the country. I can, go places. I can travel. I can do things. I can become involved in things. I can be with my students when I was teaching instead of trying to find the bathroom. So it's given me back my life.
Dr. Kaufman, are Dr. Brice's symptoms typical? Does it always come on just suddenly, or are there symptoms leading up to it that could take years to actually get some treatment?
Yeah, that's an excellent point. There's actually a wide variety of issues that result in these types of symptoms, which can vary between patients. But let me add here, just as reassurance, that rarely are any of these imminently worrisome conditions. But there are associations with aging, with hormone loss, prior surgeries, but sometimes even very subtle reasons like back strains can result in these types of overactive bladder symptoms. That being said, it's not really expected, and it's not really normal as you age. So even though it's not anticipated, this is such an exceedingly common condition, it's staggering. There's an estimated 37 million Americans who are affected with overactive bladder symptoms. So it's more common than actually high blood pressure or diabetes. And, sometimes these symptoms can progress and transform. So they may begin as something as a nuisance where you start to develop a lot of urgency to have to go, or you start to develop this frequency. But then over time, we often find that this can transform to something that's debilitating. But as I mentioned before, patients are very reluctant to seek treatment because it is an intimate and delicate topic.
Dr. Brice, was that your experience? Were you reluctant to talk to professionals, even though you yourself are a healthcare provider?
Yes, even though I've been in the healthcare field and in women's health my entire 30 years of nursing, it took me 4 years before I got up the courage to go talk to my own doctor. So, what I would tell anybody out there, if you are experiencing these different symptoms, if you feel embarrassed or, you don't want to talk with anybody, you are taking all the joy out of life. Yeah, you need to get your quality of life back. Don't be afraid to go talk to your doctor. If you don't feel comfortable with him or her, then seek out a different physician. Go find a urologist that specializes in this, because it makes all the difference of the world. Life's too short. And, out of that 37 million Americans who have overactive bladder or incontinence, there's almost 17 million of those individuals who have not sought any type of help or treatment. So that's 17 million individuals who are just living, inside. I had to be within 10 feet of a bathroom, so I know what they're going through, and they don't have to if they seek help.
Where can our listeners go online and get some more information about the InterStim Micro?
As Dr. Brice mentioned, contacting your primary care provider or local urologist is always a great first step. But there are accurate and reliable online resources, and your listeners can take action today to learn about this and gain more insight into their bladder concerns. And we have compiled all this information at a website, controlleaks.com/now.
I appreciate both of you, Dr. Kaufman, Dr. Brice, for joining us here on Health Professional Radio this evening. Lots of great information for that community. Thank you so much.
Thank you.
Thank you.
We appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Melissa Kaufman and Dr. Linda Brice. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.